Whenever we are talking about hair or hair loss, it's a really sensitive subject because if you are in the position of dealing with thinning hair, losing hair, bald spots that you're finding on your head, the receding hairline that occurs with menopause, it is mentally incredibly hard, especially as a woman. Now, guys, I know it's hard for you to lose your hair too, but let's just face it. A woman's hair it's like her crown. It's like her queen crown. And it's an expression of us. You know, whether it's short and spiky and you're a little fireball, or you have this long flowing hair that I just love my long hair. It's like a security blanket. That is our identity. And when your identity starts to fade, or you have issues with your identity, i.e., your hair, it is really, really challenging. And I would say, of all the symptoms that I see from my audience in my practice, hair loss is right at the top. It's the top three. It's right up there with weight loss or inability to lose weight and fatigue. And hair loss is always one of those that women will come and they'll say, I'm counting the hairs that come out of my head in the shower. What is this ball that I just got in my hand? And I'm getting this every single day and I'm freaking out. And it's literally the first thing that they think of when they wake up. And it is the last thing that they think of when they go to bed. And it consumes every thought throughout the day, from how they brush their hair to how often they wash their hair to how they style their hair to the products, the heat, everything that they do. That is all they think about. So, you know, I've talked about hair loss in the past on other episodes, but I wanted to actually, instead of me just sitting here telling you about hair loss, I wanted to bring in an expert that can really break down what are we looking at when we're looking at the hair growth cycle? What are the different causes of hair loss? How does hormones play a role? And then what can we do about it? Because ultimately we need an answer. We can sit here and talk about the problem all day long, but we need an actual answer that works. So today I have a dear friend and colleague, Carolina. She is the founder, owner of OneSkin. We've had her on before talking about skin, but I wanted to bring her back on to talk about hair because you know hair, girl. You know hair.
Thanks for having me again, Dr. Amy. I agree. It's such an important topic. One that I relate personally. My family has, the male, female, pattern baldness,
Yep.
and I know how it affects myself emotionally, and how it affects a lot of people out there. And it is a hard problem to solve. It is a condition that there is several attempts to find ways to reverse, to treat, but it's still a problem that most people didn't find a solution for. And we're excited to show a new way to address this problem with a novel research that we have been developing the past 10 years, and we have seen already like really impressive results. So excited to dive in and talk all things about the biology of hair aging, which it's part of our aging process, and there is a lot of things that we can do about it.
Exactly. And it yes, it's a process of aging, but it's not something that we have to accept. And I
No.
say that all along. Like, just because, oh, you're just getting older, so it's normal for you to lose half the hair on your head and
No.
walk around and we can see your scalp. No, absolutely no. We do not have to settle for that.
100%. And I think the beauty and the excitement around the science is that we know that aging is a malleable process. Like, we have reversed it, we have like bring the clock back. And so we can do that. There are many interventions that we can do, and understanding the biology of it help us to, be smarter and more effective with those interventions.
Yep, absolutely. And that's the good news, is that there are things that we can do. This is not a lost situation that you just have to succumb to and accept. So as we're getting into it, all right, first of all, I've talked about the different causes of hair loss on the show before, but I want to hear it from you because you're the researcher, you've dove into it. I mean, of course, the big ones that I've talked about: low thyroid function, loss of hormones that we'll get more into today, specifically estrogen, even some nutrient deficiencies or not eating enough protein and amino acids. But But what are some other causes that I'm missing?
Yeah, the most common, as I said, is this male female pattern baldness that's like genetic driven. So that's when people have a higher susceptibility um, to testosterone, or more specifically DHT, which is like testosterone is converted into DHT, dihydrotestosterone, and this binds into androgen receptors in the hair follicles.
Yep.
So this is mostly genetic driven, and most of the, I would say, solutions for this are products that will prevent the conversion of like testosterone into DHT, but we will talk about that also. We have hormones like, progesterone that helps like the conversion of testosterone to DHT. So there are our own natural mechanisms, but there are drugs and products in the market that target this conversion. The problem is that in these products, these drugs are mainly like finasteride and dutasteride, and they come with a lot of side effects and some potential, erectile dysfunction. So I know, for men and for women that's like on their reproductive phase, you should not use those drugs. And so that's one main common hair loss cause. The other one is what we call age-related hair thinning. And this one, it starts to be more pronounced after the age of 50. And it's basically really associated with the aging process. And it's also associated with the accumulation of these old or aged cells called senescent cells that we spoke in our last episode. So we accumulated these senescent cells, zombie cells in our whole body, in our skin, in our hair, in our scalp, and its accumulation is associated in the skin with like fine lines, wrinkles, sagging. And we are now seeing data that the accumulation of those senescent cells in hair follicles is one of the main causes of age-related hair thinning. And there is no product in the market that's targeting senescent cells in hair follicles. And why those senescent cells are bad? Because they are there not functioning well, so they're not supporting the hair growth, the hair cycle. They are also secreting inflammation, which is like disturbing the environment. This also leads to other issues in the scalp, like itchiness, sensitivity. And so targeting senescent cells can lead to several benefits, including reactivating the hair growth, improving the whole scalp health. We're going to really dive into this one. That's an important one. Then we have stress-related stress-related hair loss. We know after a certain trauma, there is the increase of cortisol can obviously move the hair that's in the growth phase to now the shedding phase, and that something that can be, reversed after the stress is gone. But there are other products like the one that we're going to talk about that can help like speed up this process of, bringing the hair back into that growth phase. And we also have the other hormone related hair thinning or hair loss, mainly associated with postpartum or menopause, when there is a very significant decline in estrogen and progesterone in the case of menopause. And the main reason is why estrogen is the hormone that keeps our hair in the growth phase, in the anagen phase. And so when estrogen drops, that the hair, that those follicles will enter into the telogen phase, the shedding phase. So that's why you see a very significant increase in hair loss, both with postpartum and menopause. And the progesterone, as I said, is the hormone that prevents testosterone to be converted to DHT. So when you lower progesterone, you have more DHT that will bind to those receptors, and again will induce more hair thinning and hair loss. And at least like 50% of people, with men is like 80%, will experience some kind of hair thinning or hair loss throughout their lives. And what we're seeing right now is that we have not thought about this problem from a preventative standpoint, right? Like we're always thinking like from a reactive, And we treat our face and our, we want to prevent all those wrinkles, but why we're not taking care of our scalp to prevent something that's very likely to affect us at some point in our lives? So that's an important thing that I think we want to change people's mindset, that we should also include our scalp almost in our skincare routine, right? Like your skincare routine is not until you go to your scalp, because in the end, scalp is the skin. Like the scalp outer layer, it's basically the epidermal layer of the skin. So these are the main causes. And we can, dive specifically in how we can treat or minimize some of these effects.
Well, I love that you mentioned the whole prevention, because I never even thought about that from a hair standpoint. That, right, we try to prevent wrinkles by using skincare ongoing. We don't wait until we're, oh, look, now I'm 55 and I have wrinkles, so I guess I'll start putting
Yeah,
something on my skin, right? So that
right.
totally makes sense that we would start treating our scalp like the skin on our face and start doing things to protect it. Now, before we get into that, you had mentioned the phases of the hair growth cycle, and I've mentioned these in the previous episodes I've done on hair loss. And I want to get your take on it, because I know that there's the growth phase, the dormant phase, and then that shedding phase.
Yeah.
And you had mentioned stress. So I've always told my patients specifically that come in with hair loss, usually when we see an increase in shedding, so people have moved into that shedding phase very quickly, isn't it usually something that's occurred a couple months ago? Like during COVID, we saw this 60 to 90-day post-COVID
Yeah.
shed. And so it's not necessary. I mean, it could be an immediate stress, especially if there's like surgery or trauma or something like immediate that your hair follicles react to and shed. But isn't it usually something from a couple months ago?
It is. And the reason is that there is a transition phase that, takes a few weeks. So when you start to experience, when you start to notice, you have been already, your hair is already entered in that telogen phase, the shedding phase. And so when you notice like the cause or the stress already happened like a few, as you said, like 60 to 90 days ago. And that's why some people also after summer, around like fall, they experience some shedding, because usually during summer you are more out and about, and then you are more exposed to sun damage, or like your hair, you're not treating so well. So you have more oxidative stress, more sun damage, and then eventually you're gonna see in the fall, the leaves fall.
Yeah.
And our hair falls as well. So that's exactly it.
Okay, that makes sense. So can you break down those different phases just so people can understand
Yeah.
those a little bit more as well? And how long does each phase last
Yeah.
usually?
Yeah. So the growth phase is the anagen phase. We should have around 85% to 90% of our hair in that growth phase. And it can last from 2 to 7 years. So your longest hair, if you keep it growing, can last, up to 7 years. Obviously, some, areas like your brow will be shorter.
Mhm.
And then you have the catagen phase, that's like a transition phase. And then you have the telogen phase that should, again, about like 10% of your hair follicles should be in that phase. So when you have more hair follicles in the telogen phase, that's when you experience this really shedding, because you should have only 10%. And then it's something that's, it's normal for you to lose like a number of like hair a day, but if it's increases too much, then that's when you should, um, you know, take action, or even take action before that happens. But this phase takes like about 2 to 3 months. So that, and then your hair should enter in the anagen again. So basically it goes from anagen, catagen, telogen, and then from telogen should go back to anagen, which is the growth phase. This is the normal, healthy uh, hair cycle. Eventually, when your cells in the hair follicle starts to age or to die, then eventually you don't, that hair doesn't enter in the anagen phase again, and basically that the hair follicle is dormant. There is no more hair coming from there. So that's when you start to really experiencing baldness. And at that point, when the hair follicle dies, then there is nothing that you can do from a product standpoint. And then it's only hair transplant.
Right. Yeah. That's a good clarification is once that spot is bald. So
Yeah.
when you look at, I think the best picture is a guy, I'm going to use the dudes, and they are like Telly Savalas, like smooth as silk. You can't even see a little dot of a follicle anymore. They're not going to slap on any kind of serum and grow a new head of hair.
Yeah.
The follicle itself is dead and gone and done.
Yeah.
So you have to actually have a follicle in order to use really anything on the market topically for that hair to actually sprout and grow.
Correct. You needed to have still the hair shaft like growing, even it's like thinner and weaker. That's the time that we can still recover. But if it's completely gone, then there is nothing that we can do from a product standpoint.
So when women are showing me pictures of like the massive balls of hair that they are getting out after one shower, that's a problem. If you are shedding more than, what did you say, like 10 to, I don't know,
I
50?
believe it's 100. I believe it's 100 follicles. I don't know if it's a week. I needed to double check. Yeah, we
Yeah.
know obviously what it's your like
Normal.
amount, and then when it starts to really increase.
Then that's a problem. So that is a sign that something is going on that needs to be
Yeah.
addressed. Yeah, actually, yeah, absolutely. So if we just have a healthy scalp, can that be enough to prevent hair loss, or is there so much more we have to do?
I would say that's similar to your skin. A healthy scalp will still be susceptible to aging, right? So
Right.
I think we want to still keep that healthy scalp, healthy and with like younger cells. So we needed to constantly be combating aging, the factors that are driving aging. So in that sense, ideally you would still use some product that would keep your scalp health because as we said, we it takes a while for us to notice that we are experiencing hair thinning or hair loss. I even saw this stats that people usually lose 50% of their hair before they start noticing it. So this takes years. Like, so if you imagine like the amount of hair that you had like back in college and right in college. So you had like a very full, beautiful hair and past like 10, 20 years, like you probably have like half of it. And then it was very gradual. So most people only will realize when it's already like, you have lost a lot of hairs. So in that sense, I wouldn't, wait to have really noticeable hair thinning. Also, what we have seen is that from our studies, even if you are not noticing, baldness or areas that are more thin, you can still increase your hair density and thickness. So you can still improve from where you are. So I think from that, point, it's advised that you can start earlier.
Right. And I would say, on top of that, yes, do the hormone therapy as well. Because as we're talking about hormones and aging, like we're talking about that, just that loss of hair as we age, it's very much tied to that loss of estrogen. So that's why we see it, postpartum after a baby, and we see it in perimenopause and menopause because that drop in estrogen and really the drop in all hormones really wreaks havoc on the hair follicle itself. Now, I'll have you explain it better, but I always joke and I say, well, you don't want see-through old lady hair. And what I mean by that is when I look at my grandmas and they have their, little gray perms going on, you can see through their hair right to their scalp.
Yeah.
Like you can literally see everything that's
Yeah.
going on because their hair has become so thin. So this lines up exactly with what you said. Did they even notice it? They probably have 25% of their hair that they did in college.
Yeah.
And that loss of estrogen, because I know my grandmas didn't take hormone replacement therapy. It wasn't a thing back then. So at that point in time, really you don't want to get to that place. You don't want to get to that place even in your 40s and 50s when you start losing your estrogen, and now you're fighting a battle to get your hair back. Now, if you are in that place, there are answers. We can do something about it. But to your point that you really enlightened me on, prevention. Ladies in their 30s and 40s, we started talking to you about your wrinkles
Yeah.
and avoiding sun damage and taking care of your skin. But this is a whole new discussion of like, oh my gosh, if I would have known this in my 30s and 40s, I would have started then taking care of my scalp and my hair.
Yeah.
So, sorry, I went on a tangent. Back to the estrogen. Why is it? Why is it that we see, postpartum, that hair loss, and then definitely as we start to lose estrogen in perimenopause and menopause and lose all the hormones, why does that affect hair so much?
Yes, as I said, like the estrogen is the hormone that helps the hair to stay in the anagen phase. So when you lack that hormone, the hair will shift into telogen, so will shed faster. So we needed that constant like support of estrogen to keep the hair in that growth phase, and that's why also, as you said, hormonal replacement, it's a great way to maintain, the hair in the anagen phase.
Okay, so this is really interesting. So I'm going to share something. So as you know, so I just went through my whole cancer journey. It was the beginning of April, and we're recording this beginning of July. So the beginning of April, about 3 months ago, is when I was diagnosed. And at that point in time, everybody was scared that it was an estrogen-driven cancer. Oh my gosh, just slash your estrogen down, take the lowest dose possible. And of course, I'm thinking, okay, when are the hot flashes going to come on? Well, I didn't get any of that. What I got, and now it's totally making sense with me talking to you. What I experienced in a very short amount of time is loose skin. So my skin changed immediately to where I was looking at my arm going, wait, this is my mom's skin. Wait, what's happening? And now it's all clicking, hair shedding,
Hair
the hair
shedding.
thinning and the hair shedding. And when we'll talk about results later, but I'm also noticing that menopausal hair receding. If anybody's watching on YouTube, you can see my hairline right now. I'm showing it. But that's another thing that I'm noticing is like, wait, what's happening to my forehead? It's becoming a 5 head. So this is very enlightening. And I know that my listeners are having bells going off. Ding, ding, ding. Okay, now I get it through this conversation. So yeah, let's keep going. But this is a whole new inspiration for me to get more consistent with taking care of my scalp. Okay, so we have a bunch of listeners. They're in this state. They're like, what the hell do I do now that I know maybe why I have this hair loss happening? There are so many products on the market, and I know you know this, and I know you researched it. And the first thing that people do is they run out and they buy a box of Rogaine. So you
Yeah.
want to break it down for us and just start there as to why that's not really going to solve the problem.
Yeah, so basically how Rogaine works, it's by, it's a vasodilator. So it helps blood circulation, so bring more nutrients to your hair follicles. That can help some, there are studies showing that you can improve hair growth. There are some, again, potential side effects. Some people find it like your scalp gets itchy or greasy. Some people have other side effects, and some people just prefer like completely drug free. So that's the mechanism of Rogaine. What Rogaine doesn't do is basically, again, combating those old cells that are accumulating in our hair follicles. And so even if you're increasing the blood circulation, if your cells in the hair follicles are old, they're not going to function well anyway. And so in our case, what we have worked on is basically show that senescent cells and the inflammation that the cells secrete contribute to hair thinning and hair loss. And so by developing this scalp serum that contains a peptide that lowers senescent cells in the hair follicle, we can allow the hair follicle to enter again into that anagen phase and basically improve hair density, hair thickness, and restore the healthy hair cycle. And we also have done clinical studies. So I wanna share a little bit about the in vitro studies that we've done in the lab. So in the lab, what we did, one is to treat the hair follicle cells with like a stress-related hormone, and then we could show, okay, when there is this stress hormone, there is an increase in senescent cells, and then we know that this will lead to hair loss. And then when we added the peptide, we decrease the senescent cells. So we already have a hypothesis, stress induced senescence, this peptide reduces it. We also saw that the peptide reduces markers of aging, inflammation, so it should be good for your scalp overall. Then we formulated in a water-based serum, and we ran these 6 months clinical studies with over like 30 participants, and the results was really, really impressive. We found a 40% increase in density after 6 months, and we saw also 42% in hair thickness after 6 months. And we even compared with some minoxidil, and we saw that like, wow, this data is actually stronger than, even other studies that were published about minoxidil. So this is really, really exciting that, in 6 months, if you use the product correctly twice a day, you can see up to 40% increase in hair density.
And I will say, I was waiting to bring this up, but first of all, I know that a lot of people are skeptical of hair products because a lot of people out there have tried a bunch of different ones. Every Instagram ad that comes across their feed, they're hitting buy now because they're so desperate. And yet it's just another product that they try that doesn't work. Girl, I got to tell you, I saw my friend Natalie Jill's progress, like her results of using OneSkin hair on her scalp for 4 months. And it is dramatic. She literally sent me her before and after yesterday, and my jaw dropped. I was like, oh my gosh, okay, I need to get more consistent with this because I haven't been consistent. And like I said, going through the last 2 months, hair was the last thing on my mind. But now that I'm here and I'm in my healing phase, and now I'm going, oh, what the hell happened with my hairline? I'm going to start using this. I'm going to use it twice a day, and I will share with you my before and after because I've already seen the results. So I know that you have, and again, it's one thing for the listeners to hear about studies and this and that. But when you actually see it, and y'all will just have to take my word for it or bounce over to Natalie Jill's Instagram and check her post out because you'll see her before and after. When you actually see it on someone that you go, holy cow, okay, this really does work. So yeah, what is special? Now I know you guys know peptides. You've been studying peptides because of the whole OneSkin line of skincare that we've talked about. But are you using the same peptide in the hair product as well? Is that the key?
Yeah, that's the hypothesis. We knew that this peptide was effective in reducing senescent aging cells in the skin. Could this peptide also, reduce senescent cells in the hair follicles? And that's the study that we ran for the past 2 years. And as I said, no other product in the market are targeting those senescent cells, aging cells in the hair follicles. And that's why we are excited because we think this is a new way to address this problem. And as you said, it takes time. Hair loss, hair thinning, it's a hard condition to solve. So it requires consistency, requires, as you said, at least 3 months to see results. And they get better with 6 months. But this peptide that we found basically reduces the amount of aging cells in the hair follicles, allows the healthy cells to replicate. So your hair has all the environment, the structure that it needs to grow a newer, stronger hair again. So that's how the peptide works, and it works, interesting enough in the skin, but it also works in hair follicle cells.
So when we are talking, you had mentioned the prescription products before, the dutasteride, finasteride, and you are correct. They come with a host of side effects. I've talked about them on the show before. I've had experts come on and even talk about the suicidal tendencies that can occur, which that's pretty extreme. So how does the OneSkin hair product actually, so it's OS1 hair, compared to the prescription hair products that are out there?
Yeah, so there is no side effects by using our products, completely drug free. As you said, it's peptide based,
Mhm.
um, only positive, like effects in the hair follicle cells. The other thing that we studied with this formula is that we added some probiotics and other ingredients that help the scalp health.
Mhm.
And we saw that the scalp microbiome also was improved. So we saw a decrease in some bacteria and fungi that are related to hair thinning and hair loss, and an increase in the good bacteria that like maintains the hair cycle, a healthy hair cycle. And even like people that have dandruff, we also saw a reduction in dandruff and in the fungi that's related to dandruff. So this is again more than helping the hair growth, is helping the scalp health, and a lot of people already seen like results in calming down the scalp. People with like itchy, flaky scalp, that's already like this you can see even faster. Like in a few weeks, you can already see those results.
Yeah, okay. And the one thing I do love about it, I will mention this because I know this is a concern for people, especially when you said use it twice a day. You know, there's a lot of products out there that almost have an oil base. And come on, we can't use an oil base on our scalp and then style our hair. So that's one thing I love about it is it's a very thin liquid base that goes a long way. So
Yeah.
you're not wasting a ton of product trying to get it right on your scalp. And you can literally dry and style your hair afterwards. So how do you said twice a day. So how do you recommend the best use? Do we dermal roll? Do we put it on after we shampoo? What do we do?
Yeah, so the product comes with a derma roller, and that helps basically increasing, small pores to allow the product penetration. So you can derma roll on the areas that you wanna focus. It could be on your front or on the areas that you part,
Mhm.
and then you apply the scalp serum and you massage, and then you can style as you want. If you're applying after shower, you can still apply on dry or wet hair. So if you're applying after shower, you can still blow dry your hair and style the way that you want. So as you said, it shouldn't make your hair greasy because it's water based,
Mhm.
and so you should be able to keep it consistent, ideally, as we said, twice a day, but at least once a day, every day.
So yeah, if we were using it for prevention, like we talked about earlier, and someone isn't seeing massive hair loss or hair thinning yet, but they do want to stay on top of it, then would that just be maybe a once a day? And would you use it all over as
Yeah,
opposed to a targeted treatment,
yeah.
like I'm going to dermal roll this twice a day and hit it twice a day?
Yeah, that's a great question. And yes, I believe once a day should be enough. We have not tested again for uh, once a day only, but for a prevention standpoint, I believe that's enough. And then you can use the applicator and apply all over so you can again stimulate the hair growth throughout your scalp, not only on the target areas.
Okay. And what is the typical timeline for people to see results? Obviously, I've mentioned Natalie's in 4 months. And I think this needs to be addressed because, as you know, many people will try a product. And if they don't see a result in 2 weeks, they're throwing it out, moving on to the next product. And with everything, I mean, with any supplement out there, with anything, I go, time out. We need to give something time, and especially when it comes to hair.
Yeah, as I said, the hair is even harder than, benefits in the skin. So the best data that we have from clinical studies is after 6 months. After 3 months, you already start seeing improvement, but
Uh-huh.
the improvement that happened from 3 to 6 is really impressive. And so I wouldn't even stop on 3 if you haven't seen enough results yet, because it can take up to 6 months for a lot of people.
Yeah, and you have to take pictures too, because
Yeah,
even when Natalie sent me her pictures, she goes, "I didn't realize." She's like,
right?
"I am so happy that I took
Yeah,
pictures because it's happening so gradually filling
yes.
in." you're just styling your hair every day. You're not going, "Wait, is this better yet? Is this better yet?" So
Yeah.
take pictures so you
Yeah,
can see your
totally.
own progress.
I definitely you can notice like the baby hairs. I have
Mhm.
so many of them here. Oh my goodness. But like the compounding effect you are gonna see with the before and afters, and then everyone should make sure to register them when starting the product.
Oh, yeah, definitely. Now, random question because especially for my thyroid peeps out there, and I notice for myself as well, my eyebrows. I mean, girl, if I don't have powder and pencil on, it's like I don't have any eyebrows. Can I use this on my brows too?
You could, yeah.
Okay.
I have we done a beta test? I forgot, but you could definitely do apply on your eyebrows. Just be careful to not, go into inside your eyes or
Right.
anything. But it could work. We also did a beta test in men on their beards, and we could see improvement, like in people filling up some patches, and so it basically, yeah, anywhere that you have hair, but we don't recommend on the eyelashes just because it's
Right.
too close to the, yeah, to
Right.
the,
It's not like, yeah, it's not eye approved. Don't be using it on
yeah,
your lashes, but yeah, definitely. I'll take before and afters of my eyebrows too,
yeah.
because that'll be really interesting to see if we can
You can put on
still.
a container that you can apply with like a mascara to be easier to apply. But yeah.
Yeah, exactly. Ooh, I like this idea. This is fantastic. No, I'm just excited to actually be able to bring my audience something that works. And again, I've said this over and over again in this interview. It just there's so much out there that doesn't work, and it's maddening. And I know the people listening that are in the position right now of hair loss, and it's like we said in the beginning, it hits you mentally so hard. It's a really tough situation to be in that they're just at their wits' end. They've tried it all. They maybe have even resorted to the prescription medications and, side effects, no side effects. They
Yeah.
need something. So I'm just very excited to be able to bring my audience a product that works.
Also, this can be combined with prescription. I think the way that this peptide works, and if people want to do, minoxidil or Rogaine plus OS1 or plus the dutasteride, like
Mhm.
it's a different mechanism. And so for these other hair loss conditions, it can still really improve because you're tackling the problem from a different angle. So there is
Mhm.
also no counterindication of like combining these with other treatments if that's what you want to do. I know, as we said, like this is such a big problem that some people just want to arm with other tools that they have available, and that's okay. This one is really gentle, safe, so it's again able to be combined with any other protocols out there. The other thing that I'm going to start doing, I haven't done myself, but I want to start using the red light
Yep.
like helmets. I think that's another way that you are activating the cellular metabolism. And so let's try all of it, right? Why not?
Why not? I mean, even if you have a red light panel, if you dermal roll, put on OS1 hair, and then just stick it right in front of the red light. I
Yeah.
mean,
Yeah.
yeah, why not? That makes sense. Now, I don't know if you look this deeply in the studies you've done, but I'm just going to ask because I have a hypothesis. Will this work in someone who, let's say, is eating the standard American diet and is totally inflamed? Or do you recommend pairing this up with cleaning up what's going in your body? Because if you're putting garbage in and you're inflaming your body and you're spiking blood sugar and cortisol, that's obviously going to affect the hair follicle, right?
100%. All the inflammation and the oxidative stress that's coming from those processed food, high sugar,
Yeah.
is definitely impact your internal body, your skin, your hair. So you're gonna see way better results because a lot of times you are trying to fix from one side, but the other side keeps like sending all the wrong signals, so you're not gonna get much far. So it's definitely like a two-way, a multiple facets approach, including with sleep, again, the management of stress, Super, super important. I think the nutrients that you need also to stimulate your hair follicles, right? Like all the vitamins and the iron and the zinc and the protein. Like our hair is made of protein. So if you're not consuming enough protein, you're not gonna get, the best results that you can. So
Right, exactly. I just wanted to lay that out there too because I want to set expectations. If people are, again, loading their bodies down with garbage, they're not going to see that this works as well. They're just not.
totally,
So,
totally.
but the bottom line is we have a product that actually works. So that alone is exciting. Very
Very
exciting.
exciting, very exciting.
Yeah,
As a scientist, we went into this area, trying our best, but knowing that it would be challenging. But it's really interesting how you start with a hypothesis, you run a set of experiments, you see indications that this should work in humans, and then you go to human studies. So it's exciting to see that we got to something really uh, special that can help a lot of people there.
definitely. And you're giving my listeners a discount as well so they can try it and they can see it for themselves. So we're giving them 15% off. We're going to put all this in the show notes. Nobody has to remember, but you go to oneskin.co/Amy, AMIE, and you're going to use that code AMIE as well. And that's going to give you 15% off the OS1 hair. So that's amazing. How long does one bottle last? If someone is actually using it the correct way, which I'm going to start using it the correct way and doing it twice a day, how long will one bottle last?
It should last about a month.
Okay.
So usually there is a kit that comes with 3 bottles, or you can buy 6 months supply, and you get even a bigger discount. But one bottle is enough for supply for 1 month.
Okay. Well, that's what I was going to say. Get 3 months worth. Sure, if you want to try the 1 month, that's fine. See if you like it. But like we already talked about, you're not going to see a huge difference in just 1 month.
Yeah.
So really, if you really want to invest in seeing your hair change, this is where I would say, get through at least 3 months worth. Give it a good try. Take before and after pictures because you will be amazed, just like I was at the results that I even saw from Natalie. So yeah, I'm in. I will be sharing my before and afters of both my scalp and my eyebrows or lack thereof as I start to use OS1 hair consistently.
I'm so excited to see your results with it. Yeah.
Yeah, no, definitely. I will share them with everybody. So just stay tuned. Give me a couple months of consistent use. So thank you so much again for coming on. I really wanted an expert on here to break down hair because it's like we said in the beginning, it's a big topic. So I really appreciate your education, your research on hair, your knowledge, and I appreciate you developing a formula that's going to make a difference for people.
Thank you so much, Dr. Amy. Always a pleasure speaking with you.
Amazing. So once again, everything's down on the show notes, so you can check it there, click the link, grab the discount code, and then keep me updated on your hair progress as well. If you post your before and afters, tag me so we can see it. And yeah, I'm really excited to see the progress. So thank you once again. Thanks for listening.